Let us pick up where we left off. We will turn our focus to the factors that influence health and ultimately promote health equity for all, the determinants of health. America's obesity problem developed over decades and likewise will require decades to fix. The nation needs a long-term, continuous commitment to policies and programs that will help all children and adults, no matter where they live, how much money they make, or what their racial or ethnic background is, achieve a healthy weight and live healthier, longer, and more productive lives. There are many factors that make some people healthy and others unhealthy. These factors that impact health status are known as the determinants of health. We will briefly review each factor: individual behavior, social factors, health services, biology and genetics, and policy making. Your textbook focuses on the social determinants of health with the social ecological framework. As we journey through this course, I would like you to consider each determinant of health and how it may impact the obesity epidemic. Following is a brief introduction to each determinant of health. As I mentioned, individual behavior plays a role in our health outcomes. For example, if an individual quits smoking, his or her risk of developing heart disease is greatly reduced. Many public health and healthcare interventions focus on changing individual behaviors such as substance abuse, diet, and physical activity. Positive changes in individual behavior can reduce the rates of chronic disease. In order to work toward optimal health, we must first understand the behaviors that promote, protect, or maintain a person's health. These actions are called health behaviors. Some common health behaviors are participating in appropriate health screenings and vaccinations, eating a nutritious diet, exercising regularly, avoiding drug and alcohol abuse, and yes, even washing your hands. Okay, do these sound familiar? I hope so. They are the drivers of our health status, chronic disease, and ultimately, well-being. At the opposite spectrum of health behaviors are risk behaviors. Risk behaviors are behaviors that increase susceptibility to illness and injury. Examples of risk behaviors include tobacco use, behaviors that contribute to unintentional injury and violence, such as not wearing a seatbelt, drug and alcohol abuse, and physical inactivity. Health behavior is an important element in enhancing an individual's health and well-being. Behaviors that are performed regularly over a period of time or habits are recognized as lifestyle behaviors. Lifestyle behaviors can be health-promoting or health-diminishing, depending upon an individual's adoption of health behaviors or risk behaviors. Social factors are the social and physical conditions of the environment in which people are born, live, learn, work, play, and age, also known as the social determinants of health. They impact a wide range of health, functioning, and quality of life outcomes. Some examples include social norms and attitudes such as discrimination, quality schools, access to resources, and exposure to toxic substances. These circumstances are shaped by the distribution of money, power, and resources at global, national, and local levels. The social determinants of health are mostly responsible for health inequities, the unfair and avoidable differences in health status seen within and between communities. Let's take a deeper look. The social factors that influence our health and our behaviors can be broken down into these categories: healthcare access and quality, neighborhood and built environment, social and community context, economic stability, and education access and quality. Many people in the United States don't get the healthcare services they need. Remember when we discovered that only 8% of our adult population are getting all of their recommended preventive screenings. Some of the reasons cited were lack of health insurance, lack of a regular healthcare provider, and problems with healthcare delivery, such as wait times. About 1 in 10 people in the United States don't have health insurance. People without insurance are less likely to have a healthcare provider, and they may not be able to afford the health services and medications they need. Sometimes people don't get recommended healthcare services like cancer screenings because they don't have a primary care provider. Other times it's because they live too far from the healthcare providers who offer them. It is also important for healthcare providers to understand the culture and individuals to have a good rapport with their provider. Interventions to increase access to healthcare professionals and improve communication, in person or remotely, can help more people get the care they need. The neighborhoods people live in have a major impact on their health and well-being. Many people in the United States live in neighborhoods with high rates of violence, unsafe air or water, and other health and safety risks. Racial and ethnic minorities and people with low incomes are more likely to live in places with these risks. In addition, some people are exposed to things at work that can harm their health, like secondhand smoke or loud noises. Interventions and policy changes at the local, state, and federal level can help reduce these health and safety risks and promote health. For example, providing opportunities for people to walk and bike in their communities, like adding sidewalks and bike lanes, can increase safety and help improve health and quality of life. People's relationships and interactions with family, friends, co-workers, and community members can have a major impact on their health and well-being. Many people face challenges and dangers they can't control, like unsafe neighborhoods, discrimination, or trouble affording the things they need. This can have a negative impact on health and safety throughout life. Positive relationships at home, at work, and in the community can help reduce these negative impacts. But some people, like children whose parents are in jail and adolescents who are bullied, often don't get support from loved ones or others. Interventions to help people get the social and community support they need are critical for improving health and well-being. In the United States, 1 in 10 people live in poverty, and many people can't afford things like healthy foods, health care, and housing. People with steady employment are less likely to live in poverty and more likely to be healthy. But many people have trouble finding and keeping a job. People with disabilities, injuries, or conditions like arthritis may be especially limited in their ability to work. In addition, many people with steady work still don't earn enough to afford the things that they need to stay healthy. Employment programs, career counseling, and high-quality child care opportunities can help more people find and keep jobs. In addition, policies to help people pay for food, housing, healthcare, and education can reduce poverty and improve health and well-being. People with higher levels of education are more likely to be healthier and live longer. Children from low-income families, children with disabilities, and children who routinely experience forms of social discrimination, like bullying, are more likely to struggle with math and reading. They're also less likely to graduate from high school or go to college. This means they're less likely to get safe, high-paying jobs and more likely to have health problems like heart disease, diabetes, and depression. In addition, some children live in places with poorly performing schools, and many families can't afford to send their children to college. The stress of living in poverty can also affect children's brain development, making it harder for them to do well in school. Interventions to help children and adolescents do well in school and help families pay for college can have long-term health benefits. Health services is also covered in social determinants of health. As indicated, both access to health services and the quality of health services can impact health. lack of access or limited access to health services greatly impacts an individual's health status. Barriers to accessing health services include lack of availability, high cost, lack of insurance coverage, and limited language access. Biology and genetics is basically just what it implies: age, sex, inherited conditions, and family history. While there is not much you can change about this, education and knowledge can help you to make informed behavior change to reduce your risk of illness. Some biological and genetic factors affect specific populations more than others. For example, older adults are biologically prone to being in poorer health than adolescents due to the physical and cognitive effects of aging. Sickle cell disease is a common example of a genetic determinant of health. Sickle cell is a condition that people inherit when both parents carry the gene for sickle cell. The gene is most common in people with ancestors from West African countries, Mediterranean countries, South or Central American countries, Caribbean islands, India, and Saudi Arabia. Policies at the local, state, and federal level affect individual and population health. Increasing taxes on tobacco sales, for example, can improve population health by reducing the number of people using tobacco products. Some policies affect entire populations over extended periods of time while simultaneously helping to change individual behavior. For example, the 1966 Highway Safety Act and the National Traffic and Motor Vehicle Safety Act authorized the federal government to set and regulate standards for motor vehicles and highways. This led to an increase in safety standards for cars, including seatbelts, which in turn reduced rates of injuries and deaths from motor vehicle accidents. Many approach health improvement with a narrow focus and suggest that individual behaviors are the sole determinant of health. However, it is the interrelationships among these factors that determine individual and population health. Because of this, interventions that target multiple determinants of health are most likely to be effective. Who knew that transportation, agriculture, and our environment can be important allies in improving our health?